I will go through one other case history, very different case history. This is Aisha, who I currently treat, and she's 14 years old. Aisha came to see me because of huge amounts of anxiety. She felt anxious really day and night and was often too anxious to go into school. And obviously, at the age of 14, her parents were worrying about the impact this was going to have on her academically, as well as everything else. She had multiple food sensitivities. So she got diarrhea and tummy pains when she ate gluten, when she ate dairy, and some other foods too. And she also had quite a lot of lipomas, fatty deposits on her body, particularly around the mid part of her back, just to the side of her spine. And this had been the case for as long as her parents could remember. Aisha was adopted from another country when she was just 6 months old. And she lives with her mum and dad, her adopted mum and dad, and she has no siblings. And Aisha is incredibly open. And she told me in the first session that she hadn't been able to find out anything at all about her birth parents. And she said, to use her words, that she felt this had left a massive hole right in her core. And when she said that, she would put her hands around her navel. She had always been anxious, had always been very prone to anxiety, but this had become more heightened after she was bullied in her last year of primary school when she was sort of 10, 11. And as a younger child, she had a history of stool withholding, which had been a lot better in the last few years, but still, again, sometimes occurred when she was particularly stressed. So she would intentionally prevent herself from having a bowel movement. And even though she was 14, Aisha also struggled a lot with separation anxiety. And when she wasn't at school, liked to be with one or other of her parents. So she wasn't happy, for example, to go on sleepovers. She wasn't even happy to go and stay with her adopted grandparents. So the first thing I noticed about Aisha, in contrast to Tom, who we were just talking about, was that she loves to talk. And I got the sense that it was very therapeutic for her to be able to talk. And what she talked about were her worries. And 90% of her worries were about other people. She would tell me about her worry for her friend who was going through a difficult time, or her grandmother who was poorly, or her cousins whose parents were going through a divorce. An enormous amount of her psychic energy was focused on other people and her concern for them. I noticed that her breathing was very shallow and quite rapid. So she would come in to my treatment room and sort of be talking very rapidly, and it was as if her breath didn't really go below her diaphragm. I noticed that she was very small for her age, very short. And all her pulses were floating, slightly rapid. The right hand Chun and Guan positions were extremely weak. And Her tongue, which unfortunately I don't have a picture of. One of Aisha's anxieties is also focused around her health, and she still likes to wear a mask wherever she goes around other people. So she wasn't happy for me to take a photo of her tongue, but she did when she was at home take a photo and send it to me. But unfortunately, I haven't got that on the PowerPoint. Her tongue was pale, short, wet, and swollen. So my diagnosis of Aisha was that she had a very strong earth constitutional imbalance. It was much easier for her to focus all of her concern on others, and her mind would get stuck in a knot, and the emotion connected with the spleen that we looked at earlier, C, worry or overthinking, was her predominant emotion. She had spleen chi deficiency leading to lots of damp, and one way that was manifesting was in these lipomas. She also had quite pronounced and almost sort of textbook, really, Ren-Mai pathology. So the Ren-Mai develops during the first year of life. And in order for it to develop healthily, it requires that the baby has very good bonding. And of course, we know that Aisha was adopted at 6 months old. And although we don't know how well she was looked after or who she was looked after by in the first 6 months of life, we do know that at 6 months old, she had an enormous rupture in her bonding. And the Ren-Mai, when it's strong, gives us a feeling of center. The Ren-Mai, of course, runs down the middle of the front torso. And this is really what Aisha was strongly lacking. And one of the classical indications of a Ren-Mai pathology is yin accumulations in the absence of physiological yin. And of course, Aisha had these lipomas mainly around her mid back. And there was a general sense that her yin was not strong enough to root her yang. Her breath was in her chest. Her chi and her thoughts were stuck in her head, and nothing was being rooted down. And stool withholding can also be a Ren-Mai pathology, because it's the Ren-Mai that helps us to acclimatize to being in the world after we're born. And if this process of acclimatizing to the external environment is not seamless, then one possible way of trying to manage that is for the child to impose control over their body because they can't control their exterior environment. And a specific way of doing this is to tighten the anal sphincter, preventing bowel movements, which is what Aisha had done since she was a young child. So my treatment was to strengthen and to support the earth element, which of course is the center, to tonify the spleen in order for it to be strong enough to move fluids and dissipate the dampness. And of course, to treat the Ren-Mai imbalance. So again, to give you an example of some of what I did with Aisha. Aisha didn't want me to use needles. So I have never used a needle on her. I've used a lot of Moxa on her. So I used direct moxa on points such as REN 8, stomach 25, spleen 15, which of course are, in the navel and level with the navel, right at the center between the lower burner and the upper burner. And particularly when used together, these 3 points have a very, very centering um, centering influence on the body. And um, they help. So, Earth children have a tendency to either be stuck with their worries in their heads or almost the opposite, rather kind of too earthed, as it were, and kind of heavy and um, lethargic and weighed down. And these points just help to create that balance between those two states. I used points again with Moxa. I also have a laser pen and I use that too, such as bladder 20, bladder 49, which of course is called abode of thought. And has an amazing impact on children who have a tendency to worry. I use stomach 8 on the head as a local point to help to unblock the yi. And again, with the intention of reducing the level of worry and overthinking. And then I needed to address this very, very deep kind of lifelong Renmai pathology. So again, with Moxa, I used some specific points on the Renmai. For example, Ren 6, which treats yin stasis and also supports the spleen. Ren 12, which is an influential point of the bowels, which had been an issue for Aisha with her stool withholding and still currently with her food sensitivities. And Ren 12 supports the entire digestive system. And then as an upper burner Ren point, I used Ren 15 a lot, which obviously has a big impact on calming the Shen and again, descending the chi down from the heart and the head. And I also gave Aisha a blend of 2 essential oils, ginger and neroli, and asked her with a toothpick to put one tiny drop of this essential oil blend on the opening point of the Renmai, lung 7, every day for 100 days. This is something that I learned from Jeffrey Yuen, which is a very, very non-invasive, very well tolerated method of treating a Renmai pathology. So I began treating Aisha about 6 months ago, and I still treat her now. She comes every week for treatment during the school term, almost every week, and less often during the school holidays. And I think from an acupuncture perspective, she probably doesn't need to come every week anymore, but she's asked to come every week because such an important part of the treatment for Aisha is being able to offload her worries and to talk. And of course, all that peripheral stuff that we do around the actual treatment that we give is an equally important part of the healing. So I'm really happy to report that the last time Aisha missed a day off school due to anxiety was 5 weeks after her first treatment. So she responded really well in the early stages of treatment. And her digestive system is much stronger. And she now finds she can eat pretty much everything she wants without getting diarrhea or tummy pain. If she really overdoes it, then she may still suffer, but she can eat some gluten and some dairy every day. And as I say, as long as it's not too much, she can tolerate it. And most importantly, she is slowly but surely bringing her attention to herself. She's worrying less about others as she develops a center, as she develops a core, as her earth element becomes stronger. She's more able to balance meeting her own needs with her concern for others. And even better, she has started to become a feisty teenager. Having been 6 months ago, a 14-year-old who always wanted to be with one of her parents. And this is healthy development. She's now 15, actually, but a 14 and a 15-year-old should not want to be with their parents all the time. And when they are with their parents, they should be beginning to voice their independence, beginning to assert their needs, beginning to question automatically doing what their parents tell them to do, and beginning that kind of long process of separation. But of course, you can't separate unless you have a center. So I see this as a really positive sign that Aisha is starting to be a bit feisty and a bit argumentative and, storming upstairs and going to her bedroom and slamming doors. And it may sound funny to say that that's a positive outcome of treatment, but it really is. It's what she should be doing. I expect to carry on treating Aisha for a while. I am going to continue to suggest to her that she's doing so well. I don't feel that she needs to come so often. And I think when she feels strong enough that she says to me, yeah, I would feel okay coming less often, that will be another sign that we've reached another stage in her healing.